Although I truly believe that hospital birth is the safest for you and your baby, I don't believe that that means you shouldn't have a choice. You should have a choice. Hey y'all, welcome back. I'm Mama Dr. Jones, a board certified OBGYN and mom to 4, and today we're talking about home birth. Who chooses them and why? What about the US healthcare system and home birth in the United States makes it difficult to compare our numbers and statistics to other countries? Who are the key players or caregivers in these systems? And what are the risks and what are the benefits? All of that will be answered in this video. Home birth is a small but growing percentage of births in the United States. And I know that you all are familiar with me, or if you're not and you're new here, welcome. I'm happy you're here. Please subscribe and stay a while. We'd love to have you. But if you are familiar with me, you know how much I value autonomy and choice. So you will not find me in this video telling you you should definitely make one choice or the other. That's not why I'm here. But I do think that oftentimes people who choose to have a home birth have been given information that is either misconstrued or incomplete. And in this video, I want to talk a little bit about the data, about the people who share that data, and about the actual risks and benefits of home birth. So let's just start by talking about why someone might choose to have a home birth. Now, I don't pretend to know all in this area. This is a multifaceted and complicated discussion. But some of the most common reasons that I think people choose to have their babies at home range from either a more holistic view or feeling more comfortable at home to lack of access to good medical care and good doctors or good midwives, to an actual concern about the safety or distrust or mistrust in the healthcare system and in hospitals in general, or possibly a combination of all of those. Let's talk a little bit about the systems at play here. A lot of people are told hospital birth and home birth are equally as safe, or even home birth is safer than hospitals. And when I see this tossed around, I often see it accompanied by a study that says midwife birth is as safe as physician birth, which is true, or a study from another country. Why are these things not the same? We have to compare home birth to hospital birth in the United States. And other countries' data isn't very helpful here. Places like the Netherlands, where you'll see really great safety data, are not applicable to the United States because we operate within a completely different system of healthcare. In the United States, people who deliver babies at home almost never have privileges to deliver babies in hospitals. That gives them an incentive to keep the patient home as long as possible. The absolute risk, meaning the overall real risk of something going wrong, is relatively low, but you're going to keep so many people home that eventually something will go wrong if you're incentivized to do that because you don't want to hand over their care. There's also a little bit of animosity between home birth providers and hospital birth providers, which leads to not wanting to bring your patient into the hospital. And this is problematic because you want to recognize something is going wrong early before it becomes an extremely time-sensitive emergency, and our system is not set up to optimize that. As compared to places like the Netherlands, where you see really great safety data, they have a very consistent way of training midwives, meaning all midwives go through the same training programs. We'll talk about that a little bit in the United States later in this video. And they have a very integrated system of midwives for home birth, midwives for hospital, and physicians deciding together who is the best candidate or the safest person to be allowed to deliver at home. And that is a joint effort to make the best decision for the patient. It doesn't happen like that here. There's no cooperation between doctors and home birth midwives or hospital midwives and home birth midwives. And so that leads us to a study in the American Journal of OBGYN, which said that up to 60% of people who are intending to deliver at home and have a midwife or other birth attendant who has said, yes, I'll deliver your baby in your house, up to 60% of those people have some kind of risk factor that would make them high risk for a bad outcome. And in any other country, they would be told you should deliver in a hospital. These are things like a history of a C-section, history of postpartum hemorrhage, current gestational diabetes, multiple pregnancy, breech presentation. All of these things are things that are often seen as home birth okay in the United States, which would never be something that was approved in another country. So this data is incomparable. We have to look at the data from our system. And I want to note here, we should improve our system. We should integrate our system more. I think that nurse midwives especially are extremely well trained and wonderful. Most of my team is made up of a lot of midwives, and I love working with them. We should expand midwife care in the United States, but we have to do that under a regulatory system of consistent training. So that moves us into kind of the next discussion here, which is the players or the caregivers in this system. When you hire an obstetrician, you know exactly what kind of training they had. We all go through 4 years of college, 4 years of medical school, and 4 years of OBGYN residency. We all are required to deliver on our own with supervision a minimum of 200 vaginal deliveries, and most of us will see twice that and be involved in more than that before we even get out of our second or third year of residency. So there is consistent training. We also have to get board certified by the American Board of OBGYN. We have to get our credentials approved by our hospital, and we have to maintain our certification on a yearly basis through a standardized system that is set up by the American College of OBGYN. There are many different types of midwives in the United States. When you hire a midwife, you might be hiring someone who is a nurse midwife that is a graduate level degree with lots of training that is very consistent and accredited and overseen much the same way that a physician or a board certified OBGYN would be overseen. Or you might be hiring someone who is a direct entry midwife, of which there are many, many great midwives who are direct entry. The problem is that it's lack of consistency in training. So some of them may have gotten really great training, and some of them may be just a post-high school apprenticeship where they're only required to deliver 20 babies under supervision before they're out on their own delivering babies the furthest from help in people's houses. I hope that makes sense. This is just inconsistency in training, and we can fix that with consistency and oversight and accreditation for who can call themselves a midwife. But right now, it's very difficult as a consumer of healthcare to be making the choice between who's going to take care of you when everyone calling themselves a midwife could potentially be trained in vastly different ways. So I want to reiterate here that this does not mean every non-nurse midwife is bad. It simply means there are probably really, really great ones, but the ones who aren't so great, the ones who have less training, they're not going to tell you that. They probably don't even know that because it's just not standard. It's inconsistent, and that is dangerous. There is a push right now to get midwifery standards in place, and I hope that we can do that so that we can expand safe midwife care in the United States, because I truly, truly believe in the power of midwives to both regain the trust that we need to gain as a medical field in obstetrics, and also to improve maternal health care in this country. Because I know there will be comments under this that says, well, maternal mortality is worse in the United States. Neonatal mortality is worse in the United States. And that is true. And we need to work on that. And we are working on that. But that does not mean that because somewhere where home birth is safer, home birth is what fixes that. Because we have to actually look at the statistics within home birth in the United States. So let's jump onto that next topic, which is risks and benefits. Before we jump in, we do need to acknowledge there is a lack of high quality studies on this topic. And the reason is because you can't do a randomized control trial on this. Most people have very, very strong beliefs about where they want to have their baby. For some people, they definitely want to have their baby at home. And for some people, they definitely want to have their baby in a hospital. So we have to not put them into randomized groups where we force them to deliver places. That would be unethical. So what we have to look at here are observational studies, meaning we look back over outcomes. And that is understandably not as good of data as a randomized controlled trial will be, but we do have some relatively good data from this standpoint, and it's all we have to work with, so it's what we need to share. I believe that everybody who is considering home birth should listen to this next discussion and understand. You need to go in knowing the difference between absolute risk. This means overall your risk as an individual of having any of these outcomes. Absolute risk for all of these things is very low when we get to the risk discussion. But the relative risk is what we care about. What is your relative risk, meaning your risk at home versus in the hospital? So let's start out with some of the benefits that are statistically seen for home birth. Most of the evidence-based benefits of home birth that we see revolve around maternal benefits. And I think this is really important because oftentimes when I see doctors talking about this, they really kind of toss this out as like not that important, but it is super important, right? The person having the baby matters a lot in the discussion of risk and benefit. So what are the maternal benefits to home birth? Definitely we see a lower risk of intervention, meaning lower risk of labor induction, labor augmentation, or things like fetal monitoring, heart rate monitoring, blood pressure monitoring. We also see a lower incidence of anesthesia use. That makes sense. If you're at home, you're not going to be nearly as likely to get an epidural as you would be in a hospital. We see a lower incidence of episiotomy and a lower incidence of both forceps, vacuum, and cesarean delivery. So all of these things are important, and I do think they should be included in this discussion. We also see a lower risk of vaginal, perineal, and severe lacerations, as well as a lower risk of maternal infection. But why do we see these lower incidents of risks? It could be the birth attendant. People who have babies at home tend to have babies with midwife care. And we know that those things are all lower when you are cared for by a midwife. And part of that is midwives care for people who are lower risk for those things in general. And part of that is just the midwifery model of care. Is it the fact that you're having your baby at home? For some of them, probably. I mean, the epidural one makes total sense. But for some of them, I really think a lot of this is just the risk of midwife care is lower for a lot of these things. There's also a chance that it's just people who are lower risk for having those things to begin with, because people who are cared for by midwives tend to, or should be, lower risk for complications to begin with. So all of those are confounding factors, but that doesn't erase the importance that we do see these things associated with happening at lower levels of occurrence when people have a home birth. I just want everybody to be really clear. You see that also with hospital-based midwife deliveries. So you can achieve that lower incidence by being low risk in a hospital with a midwife as well. Another confounding factor here is previous births. We know that people who've had babies before are more likely to deliver at home. And we know that people who've had babies before are also less likely as a population of people to have almost every one of the topics that I just discussed as being lower risk at home. So we've covered some benefits. As you can already see, this information is a little tough to tease out. It's really nuanced. Thank you for sticking with me. I think this is good information and I hope you're learning something. Let's move into the discussion now about neonatal risks. The largest study on home birth in the United States is from the Midwives Alliance of North America, and it looked at a pretty large group of home births. And if you just read the abstract, it's actually pretty encouraging. It says something to the effect of the low risk women in this cohort experienced very low rates of intervention and very low rates of adverse outcomes. And that is true. I mean, if you look at the study, that's a true statement. They're basically saying that the absolute risk of neonatal morbidity and mortality is very low. And we already know that absolute risk is very low whether you're in the hospital or out of the hospital. People can present their data however they want to. And that study, while encouraging that overall absolute risk is very low, really failed to show the comparison to actual overall risk for home versus hospital. It just showed overall risk at home, which is an important part in decision making, but it shouldn't be the whole part. What is the relative risk when we compare home to hospital? If you look at home birth, the risk for intrapartum and neonatal death is 1.3 in 1,000 and 0.76 in 1,000. If you look at hospital birth, you see 0.4 in 1,000 and 0.17 in 1,000. So absolute risk, meaning chances it happens to you, extremely low. This is why you see most home births have a good outcome and most hospital births have a good outcome. But we see a higher chance of intrapartum and neonatal death in babies who are born at home. When you use that to assess individual risk for the high risk patients, meaning the patients who probably should have been risked out of delivering at home but weren't, we see that mortality rates for a baby who is born breech at home is 22 in 1,000. That is over 20 times higher than it would be in a hospital. Likely because we don't deliver babies breech very often in a hospital, but the reason is because it is risky. The risk for mom of having a postpartum hemorrhage, you see an incidence from this MANA study of 15%, which is far higher than the 3 to 4% that we see in hospitals. So I think that this information is really helpful. I think the MANA study is very valuable, but I do think it's incomplete. And sometimes when I see it presented as the only information someone is given to make their decision, it kind of makes me cringe a little because I don't think it's the full story. We see a statistically increased risk of intrapartum and neonatal death in people who plan home birth. All of the studies I'm discussing will be linked in the description box below. Gruenbaum et al. Have also done a ton of studies on this, looking at birth records. And for intended home birth versus hospital birth, you also see a higher rate of APGAR scores under 5, which is associated with neonatal seizures, and APGAR scores of 0, meaning the baby is born lifeless. Wasden et al. Have also shown an association between home birth and an increased risk of neonatal hypoxic ischemic encephalopathy, which is essentially potentially permanent brain damage related to lower oxygen levels. Absolute risk, meaning chances it happens to you, extremely low. This is why you see most home births have a good outcome and most hospital births have a good outcome. There's a study published by the American Journal of ObGyn in 2020 that showed planned hospital births with a midwife were safer than out-of-hospital birth with any type of attendant. This study very clearly shows that when you are low risk enough to be cared for by a midwife in a hospital is the safest place that you can do that. This study goes on to give a risk comparison of neonatal mortality in a hospital being 3.2 in 10,000 and at home being 13.6 in 10,000. When you compare babies born in a hospital with a midwife to babies born at home with a midwife, 4-time increase in risk of death for the baby. I don't know that I can say that is like high enough that you should never make that decision because, like we said, the absolute risk is very low. But if it happens to you, it doesn't matter if the absolute risk was very low because that is your whole life. I'm not here to tell anyone they should or shouldn't have a baby at home. Obviously, I think it's probably pretty clear that even though I'm clearly very biased, I would never have my baby at home. At the same time, I believe in autonomy and I believe in informed decision making. I just don't think anybody should be able to make the decision to birth their baby at home without seeing this relative risk increase that happens between midwife at a hospital and midwife outside of a hospital. Does that make sense? So just to recap all of that, what we're saying is that home birth or out of hospital birth in general with the midwife is less safe for the baby than hospital birth with a midwife or physician birth with a midwife in a hospital. So basically, the place you're delivering your baby makes a big difference in this. And we're also saying the safest place to deliver a baby with the safest birth attendant is in a hospital with a midwife. This requires you all, obviously, to be low enough risk to deliver with a midwife, but this is a great argument for why we should increase midwife care, and I want to do that. How can we improve safety in general? How can we improve care? How can we expand midwife care in the United States and maybe make the moves to help the US system more mimic other places where they have better outcomes, not only for home birth, but in general. So we make those changes by really dissecting what's going on with the system. And that could be an entire other video. But I honestly imagine a world where we have way more midwives and the regulation and oversight of the training is consistent so that when you say, I am getting delivered by a midwife, you know 100% they are well trained and have been through the rigorous training that is required to take care of people who are having babies. And I think our hospitals should have home birth rooms. We should have homey rooms on one side of the hospital that are, like home, where you can do what you want and you have a great midwife seeing over your care there, where if something goes wrong, that midwife can go with you to the hospital room on the other side of the floor and still take care of you. They're not incentivized to keep you there longer than they should. You're not far from help and you have consistent care. There's no animosity between the providers and the players in the system. This is my dream. You have an operating room right there if something suddenly goes wrong. This would be a huge overhaul to the system, and I don't personally know how to make it happen. But if any of you ever start a hospital where the midwives have home birth rooms on one side and we can do our care conjointly, just taking the best care of patients possible in the best environment possible, please let me know. I will be on staff immediately. Until then, we have to focus on improving trust in the healthcare system from individuals who need that care. And we do that by regaining the trust which was rightfully lost by the paternalistic history of obstetric care. We have to make these changes, and this is on the part of the provider, and that's something that I really try to do here. I want to again reiterate throughout this discussion, I think midwife care is the key to improving maternal mortality and morbidity in this country, as well as neonatal mortality and morbidity in this country. But we can't use home birth to improve that right now, because right now, if we just increase the amount of home births, we will also increase neonatal mortality rates. But we have to earn back that trust. It was lost by bad actors, rightfully so. There are so many reasons people have a lack of trust in obstetricians, and they are all very valid, especially our communities of color. But we as providers need to work on improving that. And I hope that by being here and by expressing what I believe about autonomy, what I believe about decision making, and by giving you this upfront information to the best of my ability, I hope that I can be the change. I think that we are seeing big changes in this. I see way less paternalistic care even than I did 7 or 8 years ago in this field. So I am hopeful that we are on the way to regaining that trust. In the meantime, what can you do as an individual? You can find someone you trust, vet them, talk to your friends and family, meet with them, see if you trust them. This is extremely important. A trusting relationship with your midwife or doctor is very, very important. At the end of the day, I believe that autonomy is the main thing in this discussion. I want people to have all the information that I have, but I also want you to be able to make that decision. Because when we talk about absolute risk, like I have said 100 times in this video, we know the absolute risk of a bad outcome is low. You should know the relative risk between home and hospital, and you should be allowed to make that decision. I think that home birth should not be illegal. I think everybody should have access to the information to make the decisions that are best for them. But I also think that we really need to improve who is delivering at home and the consistency of that training so that you can make a reliably informed choice as a consumer of healthcare. So, at the end of the day, I believe that autonomy is the main point of this discussion. Although I truly believe that hospital birth is the safest for you and your baby, I don't believe that that means you shouldn't have a choice. You should have a choice. You just should have the ability to make a fully informed and educated choice. And that means we can't just present you statistics from other countries or information about midwives or midwives versus physicians and make a decision from that. You need to see the relative risk comparison between hospitals and home. And I think I conveyed that in this video, and I hope I conveyed that in this video. And I hope that you leave here feeling empowered to make the choice that is best for you. I appreciate you for sticking through this video. I know it was probably longer than normal. I hope that you learned something. Thank you for being here today. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.